Good evening. Let's start tonight with a decision that is not abstract, not theoretical, and not happening somewhere far away. It is happening this week. It involves the United States, and it involves the World Health Organization. The United States is set to leave the World Health Organization, a move that has been formally triggered and is now in motion, despite warnings that are legal in nature and global in consequence. This is not a rumor. This is not a trial balloon. This is an exit process that has begun. U.S. officials are holding the organization responsible for what they describe as failures to contain, manage, and share critical health information. That assessment, from the U.S. government's perspective, is the basis for the decision. At the start of his second term, President Trump issued notice of withdrawal through an executive order. That act set a legal clock into motion, one that does not move quickly, and one that carries requirements the United States must meet before the withdrawal is complete. Under U.S. law, the United States cannot simply leave overnight. The law requires 1 year's notice. It also requires that outstanding financial obligations be settled before departure. So when we say the United States will leave the World Health Organization, we are talking about a process that has started, not one that has finished. But it is very real, and it is very consequential. The World Health Organization, or World Health Organization, is a central coordinating body for global health efforts. Its work includes disease surveillance, emergency response coordination, and the sharing of health data across borders. The United States has been one of its most significant contributors, both financially and institutionally. That role is now set to end, and this week, the United States is formally proceeding with that exit. Even as legal scholars, global health officials, and international partners continue to warn about what this withdrawal means, not just for the organization, but for global health systems that rely on shared information and cooperation. There is a moment here that feels quiet on the surface. No dramatic vote, no packed chamber, no flashing scoreboard. Just paperwork, notices, and legal steps. But sometimes, the most consequential moves happen exactly like this. Slowly, procedurally, and with enormous reach. The Director General of the World Health Organization, Tedros Adhanom Ghebreyesus, has publicly urged the United States to reconsider. He has been joined by global health experts who argue that the withdrawal will weaken disease detection and response systems worldwide. Their concern is not framed as political, it is framed as operational. It is about what happens when a major participant steps away from a shared system. There is also the question of resources. The U.S. exit is poised to reduce the organization's funding. That reduction, in turn, affects staffing, monitoring capacity, and emergency response readiness. One global health expert put it this way, speaking with measured restraint. This is not about symbolism. This is about capacity. That kind of statement does not shout. It doesn't accuse. It simply lands. The United States, for its part, has been clear about its reasoning. Officials say the organization failed in its responsibilities during global health emergencies. They argue that accountability requires withdrawal. That is the position. That is the rationale. And that is what has now been set into motion. Former Microsoft CEO and global health philanthropist Bill Gates has weighed in as well, saying that a quick U.S. return to the organization appears unlikely once the withdrawal is complete. That statement does not speculate about motives or future politics. It simply addresses the reality of institutional separation. Once systems disengage, reconnecting them is not simple. There is a line that keeps echoing as this unfolds. It is not dramatic. It is not new, but it feels relevant tonight. This is how big changes actually happen. The decision to leave the World Health Organization comes at a moment when global health coordination remains a central concern for governments and public health agencies. Diseases do not respect borders. Data sharing often determines response speed. Those are not opinions. Those are structural facts. And so the question before us tonight is not whether this decision is happening. It is. The question is what it means and how it will unfold step by step over the next year. Because once the notice is given and once the fees are settled, the separation becomes formal. And once that happens, the global health landscape changes in ways that are difficult to reverse. One quiet quote from a public health official seems to capture the moment best. They said simply, "We are about to find out what absence looks like." That is where we are tonight. The paperwork is filed, the notice is active, and the world is watching a process begin that cannot be undone quickly. When a country decides to leave an international organization, the decision itself is often treated as the story. The headline lands, the statement is issued, and the moment passes. But in this case, the decision is only the beginning. What matters now is the machinery that has been set into motion. The legal steps, the financial requirements, the calendar that does not bend to political urgency. Under United States law, withdrawal from the World Health Organization requires a full year of notice. That clock began ticking when the executive order was issued at the start of the president's second term. It is a fixed timeline, written into statute, not subject to acceleration. There is also the matter of money. The law requires that outstanding fees be paid before the departure is finalized. Those obligations must be settled. They are not optional. They are part of the process. This means the United States is, for now, both leaving and still legally present. Participating under notice. Contributing under requirement. Preparing for absence while still embedded in the system. It is an unusual posture, and it is a consequential one. Inside the World Health Organization, officials are preparing for what comes next. The anticipated reduction in resources is not hypothetical. The United States has been a major contributor, and its exit is poised to reduce available funding. That reduction has practical effects. Fewer resources mean harder choices. Programs compete. Priorities narrow. Capacity shifts. Global health experts have warned that this will disrupt disease detection and response systems. Their concern is not framed around politics or blame. It is framed around function. These systems are interconnected by design. Data flows across borders. Alerts move through shared channels. Response depends on coordination. When one participant steps away, the system adjusts. But adjustment is not the same as replacement. One official involved in global health coordination described the situation with quiet precision. They said, "You don't remove a load-bearing wall without feeling it." That line carries weight because it does not accuse. It simply describes structure. The United States government, meanwhile, has stood by its assessment. Officials have stated that the organization failed to contain, manage, and share critical health information. That assessment underpins the decision to withdraw. It is important to say this clearly. The rationale offered by U.S. officials is about accountability. It is about performance. It is about responsibility as they define it. There has been no indication of hesitation from the administration. The process is proceeding. At the same time, the World Health Organization's leadership has continued to urge reconsideration. The Director General has called for a rethink of the move, emphasizing the importance of cooperation and shared capacity. These appeals have been echoed by global health experts, who warn that the impact will not be contained to one institution. They argue that the ripple effects will be felt across international health monitoring and response networks. That argument is not framed as alarmist. It is framed as operational reality. And yet, the process continues. Former Microsoft chief executive Bill Gates has commented on the likelihood of reversal, stating that a quick return by the United States appears unlikely once the exit is completed. That statement does not predict policy shifts or political outcomes. It speaks to institutional reality. Re-entry, once separation is complete, is complex. There is a quote circulating quietly among people who work in this space. It is not attributed. It is not dramatic. It goes like this. Leaving is easy. Rebuilding takes years. Again, it is not an argument. It is an observation. As this withdrawal advances, global health agencies are recalculating. Budgets are being reviewed. Contingency plans are being discussed. Systems are being stress-tested against the loss of a major contributor. None of this happens on television. None of it produces viral moments. It happens in spreadsheets, conference calls, and internal memos. But it is real. The World Health Organization's role in disease detection relies on timely information sharing. Disruption to that flow does not mean it stops entirely. It means it changes. It becomes slower, less comprehensive, more dependent on bilateral arrangements rather than centralized coordination. Experts have warned that this fragmentation carries risk, not because of intent, but because of complexity. One public health analyst described it this way: every extra step is a chance for delay. That sentence is small, but it matters. The United States' departure is also being watched by other countries, not as a signal to follow, but as a data point, a test case, an example of what withdrawal looks like in practice. There is no evidence presented that other nations are preparing similar exits, but there is attention, there is observation, there is assessment. And throughout all of this, the legal timeline remains unchanged. 1 year, outstanding fees paid, then separation. Until that moment, the United States remains legally connected, even as it prepares to disengage. There is a phrase that often comes up in discussions like this. It is simple, and it feels appropriate. This is what transition looks like. Not a dramatic break, not an immediate absence, but a slow procedural unwinding. As the weeks move forward, the effects will become clearer, not all at once, not in headlines, but in capacity charts and response times and resource allocations. As this process moves toward its conclusion, what remains most striking is not the speed of the decision, but the stillness around it. There are no emergency sessions scheduled to stop it. There is no legal mechanism underway to reverse it. There is no indication that the timeline will change. The notice has been given. The law has been triggered. And the United States is on a path toward leaving the World Health Organization. What that leaves behind is not a vacuum in the dramatic sense. There is no single moment where the lights go out. What it leaves behind is a gradual thinning, a recalibration, a quiet subtraction from a system built on accumulation. The World Health Organization will continue its work. Disease surveillance will continue. Emergency coordination will continue. None of that ends when the United States completes its withdrawal. But it will continue with fewer resources, and it will continue with one less major participant. Global health experts have been careful in how they describe this moment. They are not predicting collapse. They are not issuing ultimatums. They are describing impact. They talk about detection systems that rely on shared data streams. They talk about response frameworks that depend on coordination rather than duplication. They talk about preparedness as something that is built collectively, not individually. When one contributor steps away, the system adapts. But adaptation has limits. One expert described the coming period with a sentence that feels almost understated. They said, "You don't notice the missing piece until you need it." That line sits with you because it does not dramatize, it simply waits. The reduction in resources facing the organization is expected to affect its operations. This includes funding for monitoring programs, staffing for response coordination, and the ability to move quickly when new health threats emerge. None of this happens in isolation. Global disease detection is a networked effort. Alerts move from local to national to international channels. Decisions are informed by pooled data. Disruption does not mean failure, but it does mean friction. U.S. officials have maintained that the decision is necessary. They have stated that the organization failed in its responsibilities to contain, manage, and share critical health information. That assessment remains unchanged. From their perspective, withdrawal is an act of accountability. From the perspective of global health leaders urging reconsideration, withdrawal represents a weakening of shared capacity. These two views coexist. They do not reconcile. And the process continues regardless. Bill Gates's assessment that a quick U.S. return appears unlikely adds a note of finality to the discussion. Not because it closes the door forever, but because it acknowledges institutional reality. Once systems disengage, re-engagement is not immediate. It requires negotiation. It requires rebuilding trust. It requires time. And time is the one thing global health emergencies rarely provide. There is a moment that often gets overlooked in discussions like this. It is the moment after the decision, when the debate quiets and implementation begins. That is where we are now. The United States will, over the next year, complete the legal requirements for withdrawal. Outstanding fees will be addressed. The notice period will run its course. At the end of that period, the separation will be formal. What follows then is not a dramatic rupture, but a new normal. One where the United States operates outside this particular framework for global health coordination. That does not mean the U.S. will stop engaging in global health. It does not mean bilateral efforts will disappear. It does not mean information sharing will cease entirely. It means the structure changes. And structure matters. A public health official involved in international coordination offered a reflection that feels appropriate as this process reaches its final phase. They said, "Systems don't fail loudly, they fail quietly." Again, no accusation, no forecast, just observation. The warnings issued by global health experts are not about panic. They are about preparedness. They are about what happens when the next challenge arrives and the system responding to it is slightly less connected than it was before. The exit is poised to disrupt disease detection and response systems. That is not a prediction. It is an assessment based on how those systems are built. The World Health Organization was designed as a hub. Its effectiveness depends on participation. Its reach depends on cooperation. The United States' departure reduces that reach. And yet, the organization will adapt. Other nations will adjust. Partnerships will be reconfigured. This is how international systems survive change. They bend. They reallocate. They endure. What they cannot do is pretend the change did not happen. There is a quiet honesty in how this moment is being described by those closest to it. No one is pretending this is painless. No one is pretending it is catastrophic. They are acknowledging trade-offs, and trade-offs are rarely clean. As this chapter closes, it does so without ceremony. There is no final vote, no symbolic gesture, just the completion of a legal process that began with an executive order and ends with withdrawal. The United States will no longer be part of the World Health Organization once that process concludes. What remains is the world that adjusts around that absence. And perhaps the most resonant line, offered by someone who has spent decades in global health, comes back into focus here. They said, "Health is shared, whether we plan it or not." That sentence does not argue. It does not persuade. It simply states a condition of reality. This is not the end of global health cooperation. It is not the end of international response. It is not the end of shared risk. It is, however, the end of a particular relationship carried out by law, completed by process, and felt over time. And that is where this moment lands, quietly, procedurally, and with consequences that will reveal themselves not all at once, but gradually.